some parts about what we do and
Okay, looks like we've lost Deepika. We'll try to get her back. Deepika, you're on mute, I think.
Listen, yeah.
it's now with the router. Yeah, just sorry for this technical glitch. No matter how much we try, sometimes these problems do come up. Okay, so just going to share a little more about our story. So if you see, this is my dad and myself. My dad, so my journey here started at 31. That was the first time I saw my family gene showing up. That was during my pregnancy. Till then, I never had challenges on health. And I gained so much weight and never to lose it off. And for about 9 years, struggled with it. And at 39, I was at my peak of my career and, traveling the world, consulting with large multinationals. But what happened is my health, I could see my health giving way. I had mood swings, I had irritability, I had huge fatigue issues. I had 2 young kids by then, and just, while career was at its peak, health just wasn't supporting me. So that's when I decided to, go for a blood test and, medical checkup. And that's when I realized, to my horror, my family genes on both sides showed up. And what was very disappointing at that time was I was so young, and I had to take, the choice I had was to take course with medications or change my lifestyle. And since I did not get much help when I tried for the 9 years, there was nothing sustainable that the market offered. I decided to start studying nutrition because I felt was the only way out. The extensive gymming did not work, the slimming centers did not work, so they would not give me anything sustainable for me. The ray of hope was at my dad at 60 decided to study nutrition, and he decided to take charge of his health, and he was able to reverse his lifestyle problems and sustain it. However, his programs very straitjacketed, and me as a foodie that I was at that point of time just did not support. So that's how my journey of nutrition started. And today, you can see me, I'm at 47, reversed all my health challenges, and gone through the path of clinical nutrition and mind body transformation coach. That's what the name says. It is because in my journey of helping myself reverse my health, I realized that it's one, what do we eat is very important. Very, very important also is who we are as an eater. What are our belief systems around eating, what are our mindsets around eating. So until I worked on those elements, I did not see sustainable health reversal. So that's how I went on a journey of nutrition and wellness and a lot of mind related courses that helped me change my mindsets about food, about health, about life. And therefore today I support a lot of people globally in the area of health and nutrition and wellness, and helping them sustainably change their lifestyle. So we incorporated it in 2016, 2012, after 16 years of research. Some of the areas that you should know that what we look at is definitely we look at research data. We go by data given by WHO. We go by data given by CADI. We go by data given by a lot of universities across the globe and institutions that are really doing work in the area of nutrition. It's not an internet Google's search that we work on. Of course, we keep a track of it, but that's not something that we recommend to our clients. Our approach is based on what we is on very scientific research and facts and what works for Indians, because Indian bodies are very unique and we have unique cultural, physiological characteristics, and our food habits are very different from the rest of the world. And therefore, it's important that when we look at nutrition, we should be looking at what works for us, not what works for an American or a European. And we are also certified in areas of nutrition and wellness. So some unpleasant facts. Now, this is about diabetes. We are growing at a very, very rapid pace in diabetes. Not a very pleasant thing, but yes, something that we all need to be careful about, because today I see many, many families where children are second generation diabetic or third generation diabetic. And also today, a lot of the youngsters, for example, if my grandparents had diabetes at 65, me as a child I'm getting diabetes at the age of 16 and 20. And so before even I've started life, I'm seeing my health complications start, and I'm not able to live a very fulfilling life at a very, very young age. And if you see the stats, the numbers are growing in a very, very phenomenal way. Some complications, of course, it looks like a fun picture, but it isn't so much fun if you actually have seen from a very close angle or close quarter the complication that diabetes gives to people. For example, I know I have a client who at 30 did not see his dad wake up the next day because of a silent heart attack, and the father was not very old, about 54. I have a client who saw his dad, having numbness, so much of numbness in his feet that, even if there was a needle that pricked him or a pin that pricked him and there was blood oozing all over, he would just not feel it. And he saw that suffering of the dad, and he said that never will I want to get to such a situation again. I have worked with so many clients whose kidneys are now at a stage where it needs dialysis and nothing else works. And all of this is extremely painful, extremely uncomfortable, extremely it doesn't allow us to live life. And not only just us, the people who are watching it happen, the support system, the family also goes through the pain along with the patient. So it is like it makes you live too makes you live too short and die too long. And the good news is that if we just take care of some such precautions at an early age before we get to such conditions, we can really reverse our health challenges, as well as diabetes. And diabetes is not something so complicated. We always go through a medicine route, but before medicine you can do a lot of stuff on nutrition, and you can delay and prevent it and reduce the medications by a large extent. In the short term, while in the long term, all of these happen in terms of your organ failures. In the short term, it does work on your own productivity. A lot of people with diabetes are tired. A lot of people are diabetes have extreme amounts of fatigue, mood swings, a lot of anxiety disorders. I know people at 40, 42. These are CTOs who are on medications for anxiety. And it all started with diabetes, and therefore they're not able to achieve what they can because of these issues that they're facing in their life right now. Also, it really hits the pocket, because every month you're spending so much on medicines. You could say you spend the same amount on food or lesser than that, and you lead a much, much healthier and fulfilling life. Also, if you have comorbidities, it really impacts the company as well as the individual, because people with comorbidities have to pay a lot more insurance premium than others. So what is diabetes? So let's understand this, because a lot of times people don't know where to start. What is diabetes, except to say that, okay, I have a sugar problem. It is linked to your blood glucose, okay, or blood sugar, okay, and it is linked to a hormone called insulin. These are the two things we should know. And if you look at it, there are three types of diabetes. Type 1 diabetes is also called juvenile diabetes. This is where the child has got diabetes because the pancreas stops working and the insulin producing cells don't work because of the immune system destroying it for various reasons. And a lot of it starts from an infection. In this type 1 diabetes, there is possibilities of working on it, but it is not much you can do. You have to be dependent on the external insulin, which is injections. The type 2 and type 1.5 diabetes is something that we can all totally delay, prevent, control to a large extent. Like, for example, my mom, who is a second generation diabetic person, today she just on 1 mg of sulfonylurea, and her HbA1c is always between 6.5 and 7, and she's 70-year-old. But whereas her sisters are on altogether 70 units of insulin because they did not change their lifestyle when they needed to, and neither are they wanting to support that lifestyle change. So that's how type 2 can be controlled, reversed, delayed. So what is type 2 diabetes? It is that there is a master hormone called insulin, which is supposed to control the glucose levels in the body. And when the insulin levels go up, so yeah, type 1.5 diabetes is for people for whom they have not controlled their diabetes, and today they need to have injections to support their health partially, but the body is also producing some amount of insulin. And therefore, this stage of people are people who really can help themselves. We can do a lot of work, but it's not something that simple. So what are the symptoms of diabetes? One is hunger, fatigue, urination, uh, dry mouth. Bulging belly is a very significant, I would say, characteristic. So if you are suddenly seeing yourself having a belly, even if you're a thin person, then it probably, one chance is that you could be looking to be pre-diabetic, even if you did not have a family history of diabetes. Also vision, it also impacts the vision. Also, if you are at a higher stage of diabetes or at the later stages, what happens is it definitely, the healing becomes a problem. And weight loss is another area and it is not something that you're really working on, but it does happen. Weight loss, unintentional weight loss as we call it. So who are the people who are predisposed to it? Men with over 25% body fat, very predisposed. Women with 35% body fat. The one segment of people who many times feel that nothing will happen to them, but are also very highly predisposed to diabetes, are people who are called the toffees, that is thin outside and fat inside. And these are the people who have a BMI of 23 to 25. percent, but have a higher fat, would be a very high fat percentage that's over 25. Also, people with insulin resistant body type, that means you have a BMI of over 25, and the fat of 25 and above, or the women who have fat of 35 and above with a BMI of 25 and above. So these are the people, if you are in one of these categories, are predisposed to diabetes in a much more higher and significant way. So what causes it? It's your lifestyle, it's your diet, it's your stress, it's the exercise that we do may not be appropriate for us. What is diabetes finally? It shows up as a high blood sugar. That means when you check your blood tests, it says, your postprandial or your fasting is high compared to the range. But actually what's happening is that there is a metabolic flexibility that's not enough, which means that when the sugar has to go into the cells, it's not allowed to, because there's also already a lot of fat inbuilt in the cells, and food cannot enter. And what happens because of this is our food habits, our lifestyle, our physical activity, all of this causes the fat in our cells not to be used, and therefore more sugars that should be going to the cells is not going in there. And what happens internally in my body is, okay, I eat or drink anything which is starch or sugar that converts. It could be it could be a rice, it could be a roti, it could be a vegetable, it could be a fruit. All of these are carbohydrates. I eat them, they enter into my stomach. What happens after it enters into the stomach and it digests, it is broken down into something called glucose or sugar. Okay, and the sugar enters the bloodstream. What happens thereafter is, once it enters the bloodstream, it's supposed to go into the cells, but because it can't go in because your insulin production is inefficient or ineffective, and therefore there is sugar built up in the blood, in the cells, in the blood, and therefore you will see a high sugar level. So that's what actually happens. So how do we work on it? Is through our diet and through our lifestyle. And diabetes is a metabolic disorder, and it really is something that we can work on with our change of food habits and our lifestyle and our physical activity. So what is the food that we should be having? And here you can see like a pie chart, and also you can see like a portions of it. So if you look at this chart, one is we are saying that please ensure that whenever you change your lifestyle, keep your favorite foods as a part of it, because if you don't keep that, sooner or later you will not be able to, I would say, sustain a lifestyle which is good for you. Apart from that, once you know what are your favorite foods, make sure that you have 50% of your food coming from vegetables. It can be greens, one part of it greens and the other part being the regular vegetables. Now, what happens here is that many times people say, oh, I eat a lot of vegetables, but it's how you eat the vegetables, what portion in every meal, and what is the way you cook the vegetables. Now, if you do an overcooked vegetable like typical Indian households, and you say that I'm eating 300 grams of vegetables, that really doesn't work, because what we are saying then is that you're actually putting a lot more empty calories, because you're overcooking it where the nutrients are totally gone, and you're not able to get the benefits of nutrients. So it's not just how much, it's how you eat the vegetables is equally important. Unprocessed fruits. Many times people mistake fruit juices as fruits. It isn't so, because you should be having fruits and not fruit juices, because fruit juices are pure sugars. They don't have much of fiber, but fruits actually have a lot of flavonoids that really are beneficial for diabetic people or for good health. We should be looking at minimally processed food grains. When I say minimally processed, we are talking about dalia versus atta roti. Dalia is lesser processed than a atta is. Then, or we are talking about a brown rice being better than a hand pound rice, and hand pound rice being better than a white rice. We are talking about a rye bread or a sourdough bread being better than a regular white bread or a brown bread in India. Like that. Or we are talking about a steel cut oats being better than a rolled oats or instant oats. That's the thing. So again, when you look at minimally processed foods, what happens is the cell walls are intact, and what therefore happens is that the body goes through a nice digestion process, and these do not turn into fats, which cannot be used by the body. There's a whole science to it. We are going to be teaching people as a part of our No Diabetes program that you will subsequently hear about. But for now, this is what you should be knowing, that look at minimally processed whole grains and non-fattening proteins. Dals, many times we think is like a very good protein source. It is more protein than cereals are, but it still is about 78 grams carbohydrates and only 20% protein. And also it's an incomplete protein without the cereal. So it's not a very efficient protein, and it does not take care of the protein requirements that our body needs for as for on an everyday, on an everyday nutrition. Also, we should be looking at the oils that we are having. How much? Okay, less than 25 grams in a day. And also we're talking about the water. Water is an extremely important thing. If you don't have your water right, you can do a lot of these things right, but you will not see much benefits. So this is a big one. A lot of times people wonder, should I be going the medicine route? Should I be doing nutrition? Where should I start? Where should I stop? A lot of people just go the medicine route, not working on the nutrition. And what happens is the medications keep increasing over a period of time, and after which you will not see the medicines even giving any benefits, or making it your getting your sugar levels into control. So what happens always is that it really, by then it really impacts the body, and you're on high levels of insulin, you have anxiety disorders, you have a whole lot of these issues that happen, along with the fact that your sugar is not in control. At the same time, what is the role of nutrition? Nutrition really plays a very important role, because if you see WHO recommendations, there is a change in food habits that's very, very important, that WHO recommends: improving your physical activity, change in lifestyle, and a prudent use of medicine. Because medicine is needed to control sugar at a certain level, but it cannot be the only thing. It needs to have nutrition so that medicines also become effective for the body. Because if you just go the medicine route, it does cause a lot of health implication, which is heart attacks, kidney failures, and all of that. Role of physical activity in nutrition. This is another very big one. Many times people believe that you can do just do physical activity and nutrition does not play a role. What happens when you just overdoing physical activity? One, your body, it does not have the internal strength, and therefore you're more prone to injuries. You don't have as much of a quick recovery after an exercise. And what finally happens is that you cannot do the physical activity that you started doing, and your sugar levels again get back to as high levels. So if you really want benefits of physical activity, you have to be focusing on nutrition. Nutrition is like a fuel that you give to the car, and physical activity is like using the car. And both of them are equally needed and important if you want the car to work well. So this is another big area to look at, is that nutrition, physical activity are important, but sleep and stress are equally important. So we have to be learning how to manage our sleep and stress. So don't ignore these parts. And if you do your nutrition, physical activity, and manage stress well, many times your sleep cycles and all of that are improved, and you don't need to go to you don't need to take any medications and stuff like that. You will be able to manage your sleep well if you take care of these top 3 areas. So today I'm going to be announcing we've launched the No Diabetes Global Program for people across the globe, people who want to learn more about diabetes. people who want to reverse, delay, or reduce diabetes sugar levels. And this is as per the WHO guidelines. I think I may not be able to show the testimonial right now. Let's see. If we can, I will. Okay, so this testimonial is about this person. I will share the results of that. Um, so this testimonial is about the 62-year-old man. He's a kidney transplant person. He had a transplant 35 years back. And he was struggling with diabetes sugars for the last 6 years. And his medications kept going up. He couldn't sleep a night. And imagine many people, imagine a life where you want to do work and you want to, and he doesn't believe he's old. So he's been working in his own family business. And what he could not handle was the fact that he was not able to sleep a single night. And that's one of the things that diabetes does. And not only that, he would have huge amount of cravings, which would go on through the night, and he would be very frustrated, and his sugar levels would just would rise. So when he came to us, he was on these medications. You see a glycinase of 5 mg, which is a very, very high dose of medication, and his sugar levels were still about 300 postprandial. And with our program, we've been checking on his parameters, his blood reports, and you see also his kidney reports. All of them have improved over a period of time. That's how we work with our clients. We are not just talking to them. We are not just giving plans. We are also helping the person live a very healthy life. This person, Badruddin Lahiri, in 3 days, when I told him, "Sir, I'm sure you'll be able to sleep," he just laughed at me and he said, "Deepika, for the last 5 years, I haven't been able to sleep. I've asked my nephrologist and they laugh it off. I've asked my homeopath, they laugh it off. And you're telling me in 3 days you can sleep?" And I said, "Yes, sir, in 3 days I will help you sleep." And today, in 3 days, he was able to sleep. And you can see the testimonials on our website. And most importantly is that he's not living a life of being deprived. He's sleeping well, waking up well. He's not feeling hungry. Earlier, he knew he used to feel very stressed about the fact that he knew he should not be eating biscuits. He knew he should not be eating bananas, but he just could not control himself. And therefore, what was happening was a huge, guilt, huge stress, plus a huge, I would say, a lot of restlessness in this man who was like, how can I not sort myself out? What can I do not to have these cravings? And we today have sorted him out. And this is on 25th October. And you can see it's just about a little over a month that where we have helped him improve his parameters. Today, his fasting is, I'll show you the next slide. This is how we work on our clients. This is at home and this is in Apollo. He prefers Apollo clinics. We don't tell our clients which clinic to go to. They go to the clinic they are comfortable, and we are constantly checking. So if you see that this result of 97 was there, and it went back to 131 because at 97 we reduced the medications. Okay, because if we continue with the same medications and he asked his doctor to help him reduce the medicines, he would get into hypoglycemia, and that would be very, very, I would say, very dangerous for him because you cannot get into very low sugars. So now, and once we reduce the medicines, it went up by 131 and then again it's gone down. So like this, we keep asking him to check, and we keep monitoring people so that they are, they're healthy internally as well as externally. So let me tell you a little more about this program that we are starting. In fact, tomorrow is one batch that we're starting with. It's a 50-day program that we are helping through which we will help our clients to, one, understand more about diabetes, get a better handle on it, understand how to start, because there is a lot of information on the internet. Everybody says a lot of things, You don't know where to start. You don't know how to build in a structure. You don't know, what proportions. After all, like for example, I also told you to eat vegetables, fruit, grains, protein, which you also know. But how much? What kind? Which meal should I have more protein? Which meal should I have less protein? How can I cook my vegetables well? So all of these are, put into a certain structure, which will help all of you uh, change your lifestyle in a seamless way, because many times we know what to do also, but we don't know where to start. And when we start, we don't come across much sustainable ways to live the rest of our life, because diabetes is one thing that we have to make a lifestyle change for life. The lifestyle change of course can be something that we are comfortable with and can be done in a with our comfort. But where to start, how much to do, what to do, I don't know. Many times we don't know, and this program really brings in a lot of structure to it. So the program benefits are, increase in energy, lifestyle change. Of course, your sugar levels go down. There's a reduction in insurance premium. There is a lot of reduction in the monthly medicine expenses. Now, this is a client who came to us, and you can see his testimonial also down below. 60 plus year old person who was spending so much money on the insulin injections, and today he's like, nothing else. I've got better life. I've reduced so much of my monies on spending on medicines. So this is how you can get benefits of the program. So what are we going to be teaching through this 50-day program? We are going to have one webinar every week on diabetes on different areas. We are going to share practical tips and tricks that people can follow. We are going to have inspirational stories or by people, and what did they do to, and how have they been able to reverse their diabetes. And we have fair number of them, of our clients as well as people who have followed their own path. uh, Eating food, favorite foods is a very big one, because all of us have a favorite foods. Like I have breads as a favorite food, I have desserts as a favorite food. No matter how much I eat today, my HbA1c is always between 5.2. Max I have seen once to go up to 5.6, but not more. uh, Also, there will be a lot of activities given to you that you can do at the comfort of your home, so that you bring in a habit formation. And we are also going to share recipes and cooking methods for diabetes. The 7 weeks program will have 7 different areas. Tomorrow's program is about metabolic flexibility and grains, and then every week we will have different areas. The second week we do have knowledge sharing on fruits and vegetables. Third week on protein. Fourth week on physical activity. Fifth week on fats and why many popular diets don't work for diabetic people. Sixth week on mindful eating and favorite foods, and seventh week on sleep and stress. So these are the areas that we will be looking at in the 50-day program. And how can you bring in a change in your lifestyle, and bring in a new habit in all these areas, so that not only your children also can benefit out of it, because it's all about bringing in change in the household and not just for the individual. Who can participate for this program? So we do work with a lot of insulin dependent clients, and we do work with a lot of patients, like I said, a kidney transplant patient as well. Uh, Having said that, they need a fair amount of customizations, and this program is not meant for people who need a lot of customizations. It's meant for people who need a simple So yes, people who are borderline diabetic, people who had who've been having diabetes but with HbA1c 8 or lesser, and people who are strictly insulin dependent. We are not working with them on this program. So we are starting 2 batches tomorrow because this is a global program and we have people from Australia and US also signing in. So 11 a.m. is one slot where people have to log in for about 45 minutes to an hour. And the rest of the activities people can do at the comforts of their home and bring in the changes that they feel comfortable or you all feel comfortable about. So, and the second batch is starting at 7 p.m. tomorrow. And how do you register? Go to deepikachalasani.com and No Diabetes. That's a page there, and you can register for the program. And if you have doubts, there are these 2 numbers. So deepikachalasani.com has all the details and it has also the numbers. And this 50-day program with the health and wellness coaches, with knowledge sharing, with recipes and all that we spoke about, has an investment of 5,000 plus GST. And the HYSEA members, there is a certain discount as well, a 10% discount for HYSEA members. And there's a promo code that you can put as HYSEA and you could get the benefits. Just in case, a lot of times people want to know what I have studied and what makes me come out here and talk as an expert. There are these courses that I have done, which are recognized world over, and therefore allow me to be certified in this area. Yeah, so this is all from me and my presentation. I know many of you are here and wanting, have questions. I didn't see which questions they were, but I did see people having questions. So, Nirja, maybe you may want to now take over and moderate.
Yeah, I think somebody wants to know, I have a cousin who's diagnosed as a pre-diabetic at age of 25. What is needed to reverse it? Is it really reversible? What are the steps he needs to follow to live a healthy life and to prolong the diabetes, not to probably use medication immediately?
So now it depends on if he's pre-diabetic, then that means he must be on a HbA1c of 5.6, 5.8, 6. That's the range that people generally are at. So for such people, you have to be able to change your food habits and your lifestyle for life. That's when you can reverse diabetes. Now, I have had clients who even have had HbA1c of 9.6 today. After 5 years, they're still at 5.6 HbA1c. My HbA1c is about 5.2 or to 5.6 at the max. It goes at any point of time. So when we say reversal, we've also changed our lifestyle in a manner that supports our body. And for such kind of people, this kind of a program that we are launching, which is a 50-day program, which is about education, so that they don't depend on anybody else, is really, really beneficial because what happens is they know exactly why they're doing what they're doing. Many times, if you go to a doctor, he would say that please go to a nutritionist and help yourself with nutrition. But many times there is, nutritionists do not share a lot of information. They just give diet charts, which is not very meaningful and useful for long periods of time, because you don't know why something has been given to you. Of course, sugar levels have come down probably, but you don't know why. In this kind of program, in our programs, we do like to educate our clients so that they are on their own. And people like them, see, at the end of the day, every body is unique. So we'll all have to identify what works for my body, what is the grain proportion, what is the vegetable proportion, what is the fruit proportion. But there is a certain guidelines within which we will be working on. And these guidelines are shared with the clients or with people who sign up for this program. And when they know the guidelines and then they play around with those guidelines, then they will, one, they can keep checking on it, their sugar levels, and they will also know what is working for their body. Have I answered the question, or there's some more parts to it?
There's no way for me to ask him. So we'll take up the next question, Deepika. Suppose you are doing these lifestyle changes and you're controlling your diet and everything. But suppose the levels are still not coming under control. At what time, at what point should people say that no, I have to get back to medication? What is that threshold?
See, the moment you are beyond HbA1c 7 and you've done all the you've done all the medication, you've done all the changes in nutrition, it's still not coming down. See, most of the time, the body gives a long rope, and you are able to work on nutrition unless you are at that stage where, like for example, somebody is at 12 HbA1c and at 60, very unlikely that he'll be out of a medicine. But till about 60, if you are at 5.6, 5.8, and we change your food habits, then you can last definitely till about 58, 60. Okay, and many of our clients and many people I know have reversed it that way. Okay, so the first myth is that you can reverse it if you're young, and there is a lot of I would say you have age on your side, and your genes are still not aged as well as much. And when you do it at a young age, you can not take to medicine for a long period of time. Having said that, if you don't get your I would say don't get your proportions of food right, don't get your proportions of exercise right, don't do your sleep and stress correctly, then your sugar levels would go up. And if you don't want to work on the sugar levels, then you go in for medication. And 7 HbA1c 7 upwards definitely needs medication. 6 to 6.5, many doctors say, I would say, they leave it to a client to take a call and choose.
Okay. And which is the most reliable test in case somebody has to figure out whether they're diabetic or not? Is HbA1c is the best test?
No, you do your fasting, you do your postprandial and HbA1c. These three are all the three are important, because your HbA1c gives you a three-month score, and your fasting and a postprandial gives you like what is the area. So, like for example, fasting sugar is based on your how effective is your liver with respect to insulin, and your postprandial is about what kind of foods you are eating. So both are equally important. So when we know which is the area that is causing the concern, then we are able to work on that more specifically. But so all the three tests are equally important.
Okay. And you spoke of an interesting concept in your presentation called thin outside and fat inside. What about those people? How do they figure out, that they are predisposed to diabetes? Because at least fat people, they know from outside they have the risk factors. But those people who are thin outside and fat inside, how do they figure out they are predisposed to diabetes?
So one is, you see a lot of symptoms that show up. Even though you're thin, you will see your tummy belly protruding, and you see many of them like that. So after 35, you should be looking to do a medical test once in a year or once in 2 years to see where your stand levels are, to be able to decide the next course of action. Normally your bulging belly, normally your tiredness, fatigue, these mood swings, these are all and unintentional weight loss, these are all main areas of symptoms of diabetes. And this shows up even for a toffee. In fact, a person who is thin outside and fat inside, they do not have that much of fat mass. So they are, I would say they can get diabetes much faster, and it is more difficult to work with people like them.
Okay. 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 There's a question. Except the program, do you take physical consultations?
No. See, with COVID, all of us, I'm sure all of you moved on, working from home, and so did we. We do take physical consultations, but that's not for everybody. We do most of it on phone and through video calls, and then we look at a physical consultation if required, or where we feel that that it gives a lot of, I would say, many clients want to see and meet that part hasn't changed yet for a lot of people. So for them we do, but not at the start, because it's important to protect their health and my health too, and my staff's health. So we do take physical consultation, but mostly it's online now.
Okay. And how much of physical activity is needed for people with borderline sugar levels?
See, it's not just about borderline. Even if you are somebody with an HbA1c 8 or upwards, there is a cardio activity that you should be doing outside of your comfort zone. That is 30 minutes outside of the comfort zone is an extremely important, I would say, parameter for exercise. Within the comfort zone, you do not see improvements in your sugar level. It's outside the comfort zone is when you see the results. There is a lifestyle movement of 10,000 steps that you should be looking to do, because that aids in a lot of fat metabolism. And if you can do twice a week weight training or yoga, which relates to the strength training, nothing like it, because it really really helps with the diabetic control.
So looks like we have handled most of the questions that were asked, Deepika. If you have any closing comments, probably I think we can.
So thank you so much. Closing comments are: please take care of your health. This, the body gives us a long rope, and we can do a lot of things by improving our health and our productivity, and we'll be able to handle our responsibilities in a much better way, especially if you're a woman, and if you have these kind of conditions. I know so many women who have left their jobs because they could not handle home and work because of their health. So take care of your health, and if you do that, you'll be able to achieve everything in life, including your careers, your responsibilities as a spouse, as a mom, as a sister, as a husband, and all of it. So yeah, closing comments are that. And second, I would just say that No Diabetes Global Program is something that we just want to, I would say, share our knowledge with the society to help improve, people's health. So if you do know friends and family who are pre-diabetic, or who are already diabetic at this stage, and want to change their lifestyle, then please ask them to sign up for this program, because it is about knowledge sharing. Because eventually, everybody's health is their own health, their own, and all we can do are catalysts to help people improve their health in a I would say sustainable way. So do not outsource that part to anybody else except except yourself.
So,
That
Deepika, before I let you go, I have a very, oft asked question. The moment somebody is diagnosed as diabetic, the doctor's first advice is to stop eating rice. So, between rice and wheat, which is the better one for
diabetes. See, it depends on what rice, because plain white rice is today the way we see rice, white rice today, it is stripped of everything else. It's just starch.
Yeah.
Okay, so that's not, for diabetes, a very important component is fiber. And when you have rice, which is stripped of everything else except starch, then that means you're just putting sugar into the body. So obviously, the sugar in the body needs to be used somewhere, or it needs to go into the cells, and none of these happen because the insulin doesn't work as well as it should. Okay, so when you're looking at white rice, that's the issue. But if you want to have brown rice and you want to have hand pound rice, they have fiber. They are very very good, and if you're a South Indian, you must look to have it for sure. I would say,
gluten? What about the gluten in the wheat?
Gluten in the wheat. I was just coming to that. Gluten in the wheat, if your body is used to a certain food composition from the time it's been in the womb, so it's important to recognize that. The two things that differ between roti and a rice is, one is rice is so much softer, so you tend to eat a lot more. Roti, you have to chew your food, and therefore you eat little lesser. But gluten is not very, I would say, not very good for the person with diabetes. because gluten does have these components which are not very effective, not very amenable for your pancreas and the insulin. But why people lose weight with having rotis is because they tend to eat lesser, and because they chew food and they tend to eat lesser. And it's also very short-lived. So if you're looking at if somebody's eating brown rice and if you have somebody's eating roti, I've seen better results with somebody eating brown rice if you keep to portions.
Yeah, I think that's very important.
If you don't keep to portions, then that's the big problem. With gluten, it has a lot of insensitivities towards insulin and the pancreas. So especially if you're a South Indian, and please go with your brown rice, it's far better than gluten.
Okay. Thank you so much. It's been very, very informative, and I hope people will make use of this program, and HYSEA members get special discount. So
yeah. Just one question, Neeraja. I'm just reading that out. One sec.
Sure.
Apart from others, the diabetes is also termed as less or no insulin production. Is that true? If so, how is our pancreas getting affected and not producing insulin? Okay. The less or no insulin production happens in 2-3 ways. One, if you're like when you say that 1.5 diabetes, that means you have, really not taken care of your diabetic conditions. And what happens is the pancreas has something called the beta cells, which has it. So it is like a container which has a certain level of insulin production. So the beta cells over time are overused and over abused, and therefore there is not much reserves left. That's why they say that less or no insulin production. And this is for people who have really misused their, I would say, abused, misused, and did not take care of diabetes. Or even the toffee people do not have too much of capacity. If you see their structure, they're very, very, I would say, small, lean. And I see them also to getting into type 1 diabetes or type 1.5 diabetes very soon. Okay.
And one more myth before we close. People think that once they're diagnosed with diabetes, they have to stop sugar and substitute it with honey or jaggery. Do you think that is a correct assumption?
See, sugar, jaggery, honey generally are sugars in the body. Of course, honey and jaggery have a little more, I would say, nutrients, which is like jaggery will have iron and honey is more natural. But eventually it's one composition in the body, which is glucose. Okay, so when you're looking to work with the reason why we all have or a diabetic person has need for sugars are two things. One is if you start your meal in the morning with a very quick digesting carb with like a bread, like a breakfast cereal, like a idli and all of that, through the day there's a lot of cravings for sugars. That is one thing. Second is because I've been told that I am diabetic and I cannot have sugar, it becomes a forbidden food. And therefore I keep thinking it's a no food. So I keep thinking about it and I want more of it. So that's the reason why many times there are some more questions coming up, Neeraja. If you allow me, I will ask them.
Yeah, sure, please.
Yeah, okay.
We have time.
Yeah, so that is what sugars do. And the body is like this. The more sugar we give, the more the body needs. So it's an acquired taste. Sugars and salts are acquired tastes. The more lesser you give, the lesser it needs. So that's how it works. The sugar, jaggery, and honey all come as the same composition. Sugar, of course, there is nothing else apart from any other nutrient. With jaggery and honey, there is jaggery has iron and stuff like that. Okay, so you can't have sugars. See, you can't live a life not having sugars for sure, because if you look at Indian culture, sweets is a very integral part. So having them occasionally is not a problem, but when you have sugars on an everyday basis, like 5 cups of tea, that becomes a problem. So if you can make this one lifestyle change of reducing your sugars on an everyday basis, you then can have your sweets and you can have your bananas and you can have all the fruits that you want. But there's a time to eat it and there's a portion to eat it. So it's more frequency, which means like you do 3 days, you can have like 1 laddu instead of 3 laddus in 1 day. That's how you work it, right? So that's with sugars. Can we reverse it with medicine or lifestyle changes? You cannot reverse diabetes with medicine. What happens with medicine, it reduces the sugar levels for that period of time or that point of time, and it lasts, that reduced sugar levels last for a certain period, and then the body needs more, because as I said, we are not working on the root cause, we are just giving medication to push the food into the cells, because otherwise the cells are locked, and that's why we're trying to push the food, and more pressure is being given from the insulin to push the food into the cells. So it does not, you cannot reverse it with medicine, but however, you need to control it with medicine if it's needed, especially if it is on the higher side, because it is causing damage to the other organs. Definitely lifestyle changes, there is no, I would say, there is no alternate to that. You will have to look at lifestyle changes, because that is the sustainable long-term thing. And with that, you can also eat your favorite foods, you can also eat your sweets and sugars in a certain way that allows, your sugar levels will be controlled even if you eat all of those. And that will only happen with lifestyle changes and not with medicine. So can we reverse it with medicine or lifestyle changes? One answer is you cannot reverse it with medicine. You can control it with medicine, but you can look to reverse it with lifestyle changes, especially if you look at it and you catch it very early and young. And when you are in the pre-diabetic stage, very easily, even if you are at 8 and 9 HbA1c, we have had clients who've come to 5.6 and have their favorite foods and all of that. So it's not been a problem. Can we reverse pancreas beta cells? It's not reversal, but you can look to, so what happens with, since the, I would say the production of pancreas beta cells is a certain amount. What you can do is, now you can, instead of, you can conserve it. Like for example, our programs are all about how we can give our body less insulin generating foods. So what insulin is needed in one day for many people, the same insulin will for us will be needed in about 10 days or 15 days, because we give foods to our body where we are reducing the insulin production, and the body does not need that much of insulin. So what we can do is, we don't have to reverse, we can't reverse it, but we can give a lot of good foods that will delay the whole process. And many times, if you're young enough, you can also regenerate the beta cells. So that is possibility, yes. There is something, some Pallavi Mishra, I can't see.
Yeah, if I get diabetes, it will not get fully cured. Is it true?
I have seen many cases where, and ourselves in our families also, we have seen where it can be reversed and it can be cured, provided you follow the same lifestyle. Like you can't be changing your lifestyle, reducing your sugar levels for 4 years, and then going back to a lifestyle that doesn't support the body. Like for example, the first important thing for diabetic people is to eat whole foods. And we are all gotten used to eating a lot of processed foods. Like for example, our breakfast, if you look at it as an idli or dosa, it's a fermented processed grain, which came up in India as an everyday food in the last 40-50 years, after the start of the wet grinder in our homes. Till that time, because it was so difficult to do it, we would do it occasionally. And after that, if you see, there's a lot of increase in diabetes. So if you want a reversal of that, of your diabetes, then you have to look at whole grains. You have to look at whole foods, and automatically you will see, a reversal of it. But it's not like you can't eat the processed fermented food. Like for me, dosas are my favorites, but you'll have to eat it in a certain restriction and at a certain time of the day, not in the morning, as much as possible.
So, what is the best food for morning to start your breakfast?
Protein, a rich protein breakfast is very important. Anywhere between 18 to 25 grams of protein. Like for example, one egg has 7 grams of protein. Okay, then if you see, like if you look at a hung curd, it has 9 grams of protein. Like if you look at an epigamia hung curd, or it's something that you make at home, it has about 9 grams of protein for 90 or 100 grams of curd itself. So having whole grains and having foods which are, I would say, which are protein rich, are very good breakfast to start your day, it reduces your cravings through the day as well, which many of our foods are very quick digesting and therefore do not have that much protein that the body needs. So when I say quick digesting, you eat food and within 2 hours you're hungry.
Hmm.
So if you notice, a lot of diabetic people want to, eat less, want to control themselves, but in 2 hours they're hungry and they feel restless and they feel get a first episode of mood swings. All of that happens because you're eating food that is digested and already is in the bloodstream.
So I think questions are keeping on coming.
Yeah.
So we have this. We'll take this one, the last one. I hear a lot from homeo saying that they can reverse diabetes using their medicine. Is it true? Can you share your opinion on it?
See, every body is different. I'm a big fan of homeopathy. I use a lot of it for my, for the children's cold, cough, sinus. If they do have anything related with cold and coughs, or sinuses, homeopathy really works brilliantly. So I'm a big fan of it, and I, look to use that as the most preferred medicine if I do have to have, which is very rare, but I do have it. But I haven't seen much of success with diabetic. It's in my that's purely my opinion. Like right now also I have clients who are with homeo medicines. We have not been able to move that, I would say, reduce the sugar levels. The same client a year back who wasn't on homeo medicine, we brought it down, a year, not year, 2 years back, brought down his sugar levels, was in check. And then with COVID and all of that, his food habits went haywire, and then wanted to start again. But this time he said, I want to start with homeopathy and food. And we are not seeing much because this doctor has a certain prescription in terms of what proteins he can have, and he's a vegetarian. So the proteins become very limited, and we could not. So we are talking to a doctor now to see whether he can give a medicine which allows us to give more protein than what we are giving right now. So I haven't seen much of help from homeopathy in the space of diabetes particularly, but I could be wrong. It's all for you to check for your body and see if it's working for you. See, when it comes to medicine or nutrition or any of this, the professional makes a huge difference in the way we are, getting results. So, that's also a huge factor. And so if you ask me my opinion, this is in my number of cases that I've handled, I haven't seen much of a success on diabetes. But at the same time, don't go by my word. It's for you to try and check and see whether it works for your body.
So you brought up a very important point about protein requirements. If you're a vegetarian, what would you suggest for vegetarians? What are the best proteins that they can have?
See, this is a slightly controversial question also, because uh, the approach that we have taken is that if Indians have been used to a certain protein source for so many years of their life, and which is dairy,
Hmm.
that means it must have supported the Indian body. And if you're a vegetarian, then dairy products become a very instrumental, I would say, source of protein, or at least large source of protein that you could look to use. One, your body is used to it, your genes are used to it, your body is used to it, and second, it's available. See, it's very nice for me to say that, why don't you look at hemp protein and a pea protein and all of these. Of course, I give them to some of my vegan clients, but it's not something that is available freely. So when you take on foods that are not available freely, you tend not to sustain it for a long period of time. And there, what happens thereafter is that you are not able to, I would say, your sugar levels come back to the same, because if you don't have enough protein and your good fats in your meals, then automatically it shows on your sugar levels. So so I would say go with dairy. Use a large part of your, dairy has hunkered and paneer and cheese in some portion, which really work for vegetarians and for diabetes. Soya is another product that you can use, which is complete protein. And of course, today now you get spirulina and all of these, which are more, of course, specialty foods. But so between soya and dairy, you should be comfortable enough. And dals bring in some portion, but not much. And nuts and seeds bring in a little portion of protein too.
So thank you so much, Deepika. I think it was a very, very, very informative session. And I'm sure your program is very good too, and people will make use of it. Thank you, and hope we can do this program once again sometime soon.
Yes, and just not in diabetes, there are so many topics that you can
Yes.
talk about, which are related to productivity and employee health, and the small things that you all can do at your homes. Because now with COVID, I think one thing everybody's started to understand is health is very important.
Yes.
Uh, that is definitely there. And the second thing is that you're going to be at home, so there are good parts. I myself have lost so much weight using COVID, but also there are many people who have gained a lot of weight, so not a very good sign of
Right.
it. So please, yes, I'll be more than happy to talk on different topics related with health and related with employee productivity.
Absolutely. I think we have some very good programs that we do as part of our association's program for our members. So
Mhm.
we'll definitely keep in mind to invite you for some of these. So thank you so much, Deepika. It was a very, very informative session. Thank you.
Pleasure, dear, and yeah, look forward.
So we'll be in touch. Thank you. Thank you so much. And many of the participants have also thanked you. So thank you on everybody's behalf.
Yeah. Bye then. Take care.
Bye. Bye. Take care.